B, congratulations on your baby girl.
Thank you so much. I'm so happy she's finally here.
She's so beautiful. How are things going so far?
It's been going good. I walk here and there and try to get as much sleep as I can.
That's great. Getting enough sleep is going to be very important in the next few weeks.
I also have a question. The nursery nurse said something about a Hep B vaccine.
Yeah, sure, I'll go over it with you. So the Hep B vaccine requires an informed consent from the parent, so that could be you or your husband. You and your husband, actually. And once the informed consent is signed, the Hep B vaccine will be administered into the side of their thigh, also known as the vastus lateralis. This is the preferred injection site for infants.
Okay, me and my husband will go ahead and sign the consent form.
Okay, just to let you know, the Hep B vaccine is also given in a series of 3 doses. It's recommended shortly after birth. The second dose is 1 to 2 months, and the last dose at 6 to 18 months. I'll get that signed consent form for you. And I see that the charge nurse said you know how to swaddle your baby?
Yes, I practiced with her.
Oh, that's great. Just to let you know that when you swaddle your baby, you should be able to insert at least 2 to 3 fingers between your baby's chest and the blanket. This space allows your baby to breathe easily and not overheat. It also decreases the risk for sudden infant death syndrome, also known as SIDS. Your baby's knees and hips should be slightly flexed to prevent damage to the hip joint. And to reduce the risk of SIDS, your baby should sleep lying flat on a firm mattress when swaddled. It is also recommended to stop swaddling your baby when they're at least 2 months old. This is when the infant becomes capable of rolling over.
I see. Thank you. Oh, I have another question. I've seen the nurses use this blue thing. I've never used it before. What am I supposed to do?
Okay, so this blue thing is called a bulb syringe. This helps your baby's airway free from mucus. You should suction the baby's mouth first and then the nostrils. This prevents aspiration. You can press the bulb syringe before inserting it into your baby's mouth or nose. Use it any time your baby's nose is congested or has a bubbly cry. You'll place the tip of the syringe in the side of your baby's mouth, not the center. After removing the secretions from the baby's mouth, you can recompress the bulb, and then move on to the next nostril.
Okay, I see. How about bathing? Is there a certain way I should do it?
So with bathing, you should begin by washing the baby's face with plain warm water. The trunk and extremities are then washed with warm water and mild soap. Then you would wash the diaper area next. If you're washing her hair, then that should be the last thing you should do. You would want to dry your baby first and then wash your hair. So this decreases their risk of hypothermia, so you can keep them warm.
Okay, thank you. Also, my baby has a lot of wet diapers. Is that okay?
Yes, it's normal. Newborns have 6 to 8 wet diapers a day. You'll see them make a bowel movement in 24 to 48 hours. And this also shows that the baby is getting enough nutrition during breastfeeding.
What position do I breastfeed her? I only know the sideline my mom taught me.
Oh, sure. Well, the most common is the cradle. You place your newborn in this position, placing her skin to skin on your chest. You will cradle her head in the bend of your elbow, holding the baby at the level of your breast, facing towards you. Position her body in alignment during the feeding with her mouth, in front of the nipple, holding your breast in a C position. Your baby's nose, cheeks, and chin should be touching your breast during breastfeeding. If your baby has a good latch, you will see his mouth and lips covering part of your areola. There's also the football position.
I see. Maybe I'll try out the cradle.
Okay. Do you have any other questions?
No, I think I'm good.
Okay. I'll be right back. Pause.